And welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, really pumped up to have you here. And for a few reasons, because we're bringing some just exciting conversations with real leaders that are painstakingly changing the future of healthcare. And we happen to be really passionate around leadership, access to care, healthcare innovation, adoption. So if you haven't tuned in before, if it's your first time tuning in, welcome. Great to have you here. And let me just tell you a little bit about what we're trying to do here. So we're a healthcare innovation company. We're focused on bringing stories of innovation within our space to life. And it's really getting into the trenches, real people that are really doing things and capturing their stories and bringing them light, not only to our community, but to the world. And we've just got an amazing action-packed year of just some phenomenal guests. So if you haven't had the opportunity, make sure you hit the subscribe button now. Any of the new interviews come right directly towards you. And in this rapidly changing just sort of environment that we're in, it's essential to have leaders who see the future, who embrace new ideas, and know how to put them into practice. And our next guest, Matt Ohrt, he's one of those leaders. He's the co-founder and chief healthcare officer at Self Fund Health. He's a published author. Matt's really been at the forefront of transforming employer-sponsored healthcare in America. And he comes from some pretty interesting, humble beginnings. Growing up in a farm in Iowa, he learned really early on the values of hard work, integrity, and just ingenuity that was needed to sort of solve problems. And a lot of those things translated into his career and those guiding principles. And he's been at some just really renowned companies, including the Toyota Motor Manufacturing Company, Badger Mining, and Merrill Steel. And it was in sort of Wisconsin's heartland where Matt orchestrated, from what I've seen, really a healthcare revolution, implementing strategies, get this, that froze premiums for 6 consecutive years and realizing over 5 million in total cost savings, benefiting both employers, employees, and their families. And his ambition didn't just stop there. Not just wanting to revolutionize healthcare for one company. In 2018, he founded the Employer Healthcare Best Practice Group, which is now rapidly growing into a formidable collective of over 250 employers and 600 free market providers, vendors, who are all committed to delivering sustainable healthcare solutions. So Matt, just super excited to have you here. Welcome to the show.
Yeah, it's great to be here. Look forward to it.
Yeah, so let's dig in a little bit into your story and your background. When we first sort of chatted, you had a pretty profound story that really sort of shaped the trajectory of your future. Would you mind maybe just sort of giving the audience a little bit of background on that?
Yeah, are you referring to the tractor part or
Yeah,
I've
that's
led
kind
a
of that's
yeah,
kind of a hard story not to forget.
yeah, no, I've led a very active life, and that incident, I joke and say I got into healthcare by accident. That was really fuel for my fire. But that could have ended my life and probably should have ended my life based on odds. But I was working so we had started our healthcare journey at Merrill Steel. So we had done a few things, but I was working in my backyard, which is along the Wisconsin River, one Saturday close to midday, and I was just pulling up some trees from the bank with an old, it was called a Ford 861, kind of like an 8N. Heavy tractor though, I mean, not small, about 4,000 pounds, heavy enough, right? And it was up on the flat, and I was working behind it. I was hooking up a chain in, and it started rolling backward. The parking brake came loose, and in trying to just put my hand on the wheel, on the big wheel to stop it, because it was more or less flat ground, it hit a dip, uh, and then pinned my steel-toed boot underneath it, which then set a course of action that I was powerless to stop. In fact, in I think about a tenth of a second, it was what it felt like. I was under that tractor, and it was rolling backward down this very steep embankment, 42 feet, then into the Wisconsin River. And so it was quite, it rolled directly over me. It didn't brush me. It didn't knock me down. I had the rear tire marks across my chest, 5 broken ribs, and a whole long list of other injuries, but nothing nothing fatal and nothing, that would paralyze me or something like that.
So in going through that process,
Yeah.
talk a little bit about what that meant in terms of how you approached your career, how you viewed situations like this. Share more about that.
Yeah. Yeah. So that was followed, by an ER, of course, an ER visit. And there was some healthcare experiences. Now I've been around healthcare my whole life, right? I mean, in HR and so forth. But I think sometimes when you go through things firsthand, there's just, and I was already learning in this process a couple of years in, but it really caused me to put the pedal down as soon as I was better. But the first was, I just as a couple examples, my daughter rolled me into ER, and here I am, almost can barely move at this point, right? I mean, like even an
Mhm.
inch, like I am just in deep pain. And she hands me a clipboard and is forcing me to fill out this clipboard. She didn't even look up for maybe it felt like a minute. And I was like, ma'am, I just got ran over by a tractor. I've learned that I could be bleeding inside, and maybe you should probably light me up on the table. And that's what they did. And a whole bunch of CTs. And just as another example of things that motivated me, then I did end up staying the night. I didn't want to, but I tried to walk out and I got nauseated. My stubbornness wasn't enough. But spent the night, and then a physical therapist had stopped by the next day. So it was close to midday and I was wanting to go home. And but he wanted to, he said he had to talk to me. So he stopped in and he had this kind of checklist, and I was very adamant. I said, I have a PT at work. We had just put a physical therapist on site, and I would have him at no cost and within my health plan and so forth. And he was just adamant and said, I need to just ask you some questions. The hospital makes me do this. And he asked me, I think it was 3 or 4 minutes worth of questions. And then sure enough, later I got a bill for somewhere around $380 for his 4 minutes of questions that I tried to deny. And there were quite a few other things. There were nurse practitioner charges. I said, how many nurse practitioners were there? It's like NP charge, because I had to request an itemized bill. And just that whole process really, really fueled my fire to say, I already have a drive to stand up for others and help them. And then that was the ticket to really make me go.
All right, so now you're back in the office, and you've gone through this experience. Where do you start? Where do you start in terms of peeling back the layers and trying to innovate? And by the way, when you think about innovation in this space, how do you define
Mhm.
innovating within the employer health space?
I think I've always been an innovator. I'm, as you mentioned, a farm boy from Iowa, so I'm not a Wall Street entrepreneur kind of thinker. I don't care for Wall Street. I don't care for stocks. I have zero interest. But I'm pretty good at solving problems. I'm pretty good at just developing the relationships with others to solve those problems. So we had done some things. We had really started our healthcare journey. We had put in an on-site clinic through what we call direct primary care. Direct is then kind of taking out the expensive middleman. We had put in this on-site PT, as I mentioned. We were working on on-site chiropractic and on-site MRI. So we were rolling, but we hadn't done some of the big things yet. We hadn't changed our plan design. We hadn't changed our partners. And so, and that's really tough. So as I realized, the further I went, I realized that I came in one morning. In fact, there's a story in the book where it was like 5 a.m. and I couldn't sleep, just like this morning. Now I'm going again on a new thing. But I couldn't sleep, so I got up, and I'm in almost alone in the dead of winter. The plant's running at 5, but here I am looking at my whiteboard and got a coffee in front of me, and it's dark and I'm alone. And I put my partners on the board, and I just asked a basic question. I said, who can I trust? Who is, instead of resisting my efforts to go forward, who's actually with me? And what was interesting, none of them, I couldn't say yes to any of them except the direct primary care that I had just started with. Um, so through the course of the next couple of years, we ended up changing our plan design and changing every partner that we had in healthcare, which you can imagine is a bit of a shakeup.
I, when it comes to employer health, there's just a lot of costs that are involved, and the jury's not out yet on how good the outcomes are.
Hmm.
What is something that employers really need to sort of be aware of when it comes to this? What are some of the myths that we as consumers have been led to
Hmm.
believe, or even employees have been led to believe? Can you talk about maybe some of those myths and maybe
Yeah,
debunk some of them?
there's a couple that come to mind, Michael. One is that one is that healthcare is kind of untouchable. So, in other words, I used to think, well, the only real factor of whether we have a lot of healthcare is whether someone gets sick or whether they don't get sick. And so the notion of a claim is a claim is a claim is really false in that a knee surgery may literally be 25,000 at one place and 30 minutes away or down the road it may be 100,000. And it may flip-flop even because they don't tell you the price, so they kind of bill you what they want. Imagine, right? The ER struggle, where you go in and you sign the paper and it says they can bill you whatever they want at whatever upcode level they want. So I think realizing that businesses have the skills to manage their business, obviously, or they wouldn't be in business. But it's interesting that healthcare is just off the radar, and it shouldn't be because it's their second or third highest cost. And the other myth that comes to mind is just related to self-funding. But in fact, I just heard it yesterday, and this is real beliefs. So there's parts of the industry that maybe don't want to go self-funded in terms of they're more profitable on the fully insured side. But this notion that we tried self-funding, and it didn't work. And so self-funding isn't really that risky because in almost all cases, except unless you're a giant company, one of the largest in the country, you're going to have a stop loss insurance on top that protects you from the big stuff. But they'll make comments like self-funding didn't work. And of course, it kind of gets me going, but right, but it's not the self-funding that failed. I mean, that's just how you funded your plan. That's how you
Hmm.
funded your plan, and that's how you managed your risk. But if you don't do anything to change the way that you spend, right? So that's what matters. You have to spend less. You have to shop wisely, and that's really been suppressed and shut down in healthcare. So I think when employers understand that it wasn't the self-funding part that failed, they were just lacking a medical strategy. When we started at Merrill Steel, in the last 5 years, we're 9 or 10% before I got there every year, and the owners were saying we can't keep absorbing this. They were already self-funded. So we didn't switch from fully insured to self-funded at Merrill Steel. We just implemented a medical strategy that helped us win.
More on that. When you talk about implementing a medical strategy, do you have someone clinically oriented on the team to help you kind of navigate those waters? And if not, how do you navigate those waters in terms of making those types of decisions?
In the strategy that I kind of built from scratch and really didn't even know what I was doing at the beginning, right? That we kind of
Yeah.
figured out together. I would say that the direct primary care, right, is the hospitals use that as a funnel. So we use it as a funnel as well, except we give primary care like it was 30 years ago, that you can actually have a relationship, that you can get in a couple days, that you can contact them outside of the meeting and so forth. But I would say that the DPC, that you should make them your medical director. You should make them the heartbeat of your medical strategy. And then you have a doctor right there, as I did. You have a doctor to go for that medical expertise that I don't have. I don't have a medical background. So that's the way I did it.
So you really lean on them as a partner. As you said, hey, I'm moving ahead. Who can go with me? And it sounds like, the DPC is really your your chief medical officer in a sense, your de facto
Yeah.
chief medical officer.
Yeah.
And any other, you mentioned too, are there any other myths that came to mind?
Hmm. Um, yeah. I think it's probably fair to put it in the myth category. So I believe, by the way, they call them the BUCAs. So I don't know if your audience knows healthcare, but the big insurance, if you will, that I'll start with the B, U, C, and A. I believe they've had a really negative effect on both sides. Now, I tend to defend hospitals. In many cases, they don't deserve it. I've had former hospital executives telling me to stop defending hospitals, but I really believe that hospitals will come around, that they've been affected, and even the advisors on the other side of the bucas have been affected. Both they've been highly commissioned, but then in fact they've kind of been enslaved by them because if they start shifting accounts, they will cut off all of their accounts. Um, so Yeah, I think there's some myths about maybe the entities that are involved, and maybe that they one blames the other and one blames the other. I don't know if they're there, and I could tell you lots of examples where they shouldn't be defended, but I really believe that the hospitals long term should come to the good side of free market healthcare, and that they can win with us, that they don't have to be a loser in this game of us shifting to free market healthcare instead of this monopolized version that we practice today.
So, switching gears quickly, when did you realize that you wanted to sort of co-found self-fund health? At what point did it become apparent that, hey, I've got something here. I have a methodology that is clearly scalable because you
Mhm.
had started, the best practices group, and that clearly
Yeah.
took off. When did you kind of figure that the next step was to launch another company?
Um, it was around maybe 2021 or so. So I started with Merrill Steel in 16, and we took the plane off, and then we figured out how to fly it and build it. But I'm wired in a way. So essentially had built that plan up, and I there wasn't a lot left. I mean, there's always continuous improvement. But when I left, I said, I've built this race car to run. It's only going to get better from here, and so forth. There's some things that haven't even kicked in yet that we just did. But I met a gentleman by the name of John Barron from Madison, who's an entrepreneur. And so that was kind of, and I even had a short stint with a company in between, but John and I had met my last month at Merrill Steel. But I was kind of getting the itch to, maybe I'd done 25 years in HR, maybe I kind of want to lead a business, or I want to do something more entrepreneurial of my roots. When I was a kid, I had my own
Mm,
baseball card shop. I grabbed my shovel and went door to door. I had a construction business for 7 years during school. I've always been very entrepreneurial, but it had always been kind of restricted by the corporate world. So
mm.
that was kind of the itch. My parents divorced when I was 3, so I was back and forth between a farm in Iowa and even northern Illinois. And so I've always been like, I'll get it, I sit down for about 5 minutes, and then I think of 5 things I need to do or want to do, and I get back up. So kind of that kind of anxiety or energy level, if you will, carries with me.
So talk a little bit about sort of self-fund health, and maybe just the journey of the company, and where you all are focused today and where you sort of see the future.
Yeah, it's been challenging. I've been, in fact, lately burning the candle at both ends a little bit in terms of hours, but it's only because I see opportunity. It's not out of stress. But we're just starting our 3rd year, and so we're kind of unique in the market that we took this plan and we said we can help a lot of people, and we've actually enhanced it quite a bit. We've got real-time data, and we've got an on-staff nurse team, and some things like that that I didn't have at Merrill Steel. But yeah, things have gone well. We started out, with just a sample of employers with 3 the first year, and to oversee their health plan. But now we're past 15, or we're approaching 15 or more. And we see we're not even in the busy season, right? As you get to September, October, we expect significant growth. So we are ramping up, and we're getting schools and all sorts of bigger companies now. So I think there's a real need out there. And what we're offering really, I think, is unique, not just in Wisconsin, but maybe in the nation. I'm not sure if I know of anybody like us.
Right now, your footprint, your beachhead is in Wisconsin. What does it take to go from one state to another state? Is that more infrastructure needs to be built out, more staffing, more tech, and talk about, you mentioned some of the analytics and real-time data. Maybe if you
Mm.
can speak to that, that'd be super helpful.
Yeah, 2 or 3 things. So we work through forward-thinking advisors, which are somewhat of a minority, but there's more and more coming to light here, I think. So that's growing. So we have a person that does kind of like the advisor relations. So we would need to ramp up that part of it. We also have an
Mm,
on-staff nurse team that does not only navigation, but really, I call them kind of hand holders. They hold the patient's hand, and they teach them of what they need to know. They help them with the bills. They'll make appointments, they'll cancel appointments, they'll transfer medical records, but just kind of making this very complex process simpler. And then one of the biggest things is kind of is in healthcare networks. So we don't shop in networks anywhere else, by the way, right? When we don't need a Best Buy network or a Sam's or a Costco network, but that's one of the ways they've restricted the free market. And so, but we need some form of contract agreements if we spread to other states, whether it be through an independent network, The bucos don't let you shop. They want you to stay in their network. So we would need an independent, or we would simply go to these hospitals and go to these independent imaging, orthopedics, oncology, cardiology. We would direct contract with them. So
Is it,
I'm not a fan of trying to send less money once the bill's been sent, as they call it, RBP strategy. I'm more RBC. Let's get in a fair agreement up front that's win-win, and then we'll just stick to that, has been my approach.
why don't people just do that? That seems very simple and very straightforward.
Well,
Why is it so difficult?
it is, there's when I look at, if I were to kind of list out all the things I did at Merrill Steel, like I said, we've even enhanced it since then. There's probably 30 to 35 pieces, but I think there's a lot of fear, I mean, and that's why I even titled through John Trinus's feedback, the first line on the book is "Save Your Company." This actually, I think, is becoming and is going to be an actual threat to the company, because they say that, to do nothing is actually a choice. I think that's even in a song, right? But so I think a lot of people, they don't realize that, and they want to just kind of pretend everything's somehow going to get better. And I don't think it's going to get better. It's going to get worse. But as an HR person, which I was a very unique kind of HR person, I was actually a change driver, not a change avoider. Many are kind of afraid. And I would suggest for any HR folks listening to not be afraid. Look at the opportunity instead of what might go wrong. Look at what might go right. And so, but in companies, especially at least in manufacturing, and they would say things like, if there's an issue on a team, they'll use this phrase, "There's an HR issue." So I would say, stop doing that. Maybe there's a teamwork issue or something, but HR tends to be afraid, because if the pool of employees, say the culture shifts or the morale's low, then we have an HR issue, and now we need somebody to blame. It must be the HR leader's fault. That's a bunch of silliness we need to stop. The leaders are the ones that lead that. HR certainly is a player there, but yeah, so I think there's a lot of fear to the HR teams, and then there's a lot of lack of knowledge. Nobody understands this stuff. I worked in this in and around healthcare as an HR leader for the first 2/3 of my 25-year career, and I didn't know, when I started really digging in 16, I didn't know anything. I knew what a deductible was, and I knew what the insurance industry had handed me and taught me, and that's it.
Right.
And so that was part of my motivation of writing the book, is we've got to learn how this really works, and then we've got to find a way that we can actually win, because we have this win-lose situation going on, with the sellers are winning and the buyers losing, and it's just not sustainable. So that's not even good for the sellers if you think about it. They need a sustainable path too. So that's what I look for and aim for, is win-wins.
Absolutely. So let's talk a little bit about the book. I mean, you've uh, you've got this formula, and then all of a sudden you say, "All right, let me just let me put this book out." So the title of the book, for those that haven't read it, "Save Your Company, Don't Feed the Beast: The Employer
Mhm.
Healthcare Success Formula." What what do people need to know about that?
Yeah, I think one interesting thing I like to point out, is I didn't title it "Fight the Beast." Right? So we're not interested in a fight per se. We're interested in offering alternatives and opening back up a free market that's been duopolized or monopolized. So we need to open that back up so we can shop, just like we do for everything else. And so, but we've got to quit feeding these buka beasts, really, and these others that are suppressing the market, and they're making in the tens of billions, hundreds of billions. I mean, the money is just ridiculous. And that's all on the backs of working Americans. So I'm not okay with that. And I don't think most Americans are okay with that. So one of the things I realized when I went to learn about this stuff, there was one book, and it was that John Trinus book, maybe a couple others. The Price We Pay was out. But
Right.
from an employer viewpoint, there was a complete lack of a way. If somebody was motivated, there was nothing to read. And so I said, I think I need to build on this, and I think I need to do the second book like John Trinus, right, where the employer who led a success story of how to do it. And so that's where the book came into play. And it took me a while, and I didn't rush through it. I wanted it to be fun to read. I wanted it to be informative. So it was a little slower than I wanted, but it worked out well. And now I'm being invited all over the country to speak and share on it.
Look, you're someone who sat in the seat. You're a peer. I mean, you're talking to other HR executives. You're not teaching something that you haven't actually done. You've done all those things, so your level of authority carries a lot of weight. I'm curious, what's the appetite for innovation amongst employers these days and those that are sitting in the leadership roles? You mentioned folks that are just sort of happy to be there, but like, what's your overall sentiment in terms of being invited and doing speaking over the country? Are we seeing a
Mhm.
wave of innovation coming?
Yeah, I mean, interesting the way you put that. So I would define at least one way to define innovation would be to charter a path or to blaze a trail that doesn't exist. And at least in the healthcare space and the benefit space, as it's called within companies, I'm not seeing much innovation. What I am seeing is that when they realize that this strategy and this approach, this free market approach, is proven, and I think this is kind of where you're going. Um, but I like to just make I see them completely terrified of innovation in HR or benefits. But if they realize the way is proven and that this path is more or less paved now, and now there might not, because we must have had 50 plus meetings with employers, and I don't think we've had any one of them where they weren't excited and say this is completely intuitive and this is completely the way we manage everything else. They always usually get excited. But it's when they know that many companies are doing it, many companies have done it, and the biggest variable actually comes down to the leadership side, not as much now the healthcare strategy side, because we know that works. So then it comes down to leading change well.
Hmm. How do you help the clients that decide that they want to start this change? Because you mentioned about sort of the change management component, and much of innovation really relies on sort of being able to manage the human side of change. What have you found to be very helpful in that? Because I can imagine the amount of pushback that you got during your time sitting in the seat. What have you learned, and what can you share with other leaders that are considering making this type of move?
Mhm. Yeah, I've got a whole chapter on it. In fact, this has been a passion of mine. It's not like just a couple of paragraphs or something. This is like the
Yeah,
variable.
yeah.
And so I call it, leading a group of people to kind of transformational leadership, leading a group of people from here to there. And so the interesting thing about most people and kind of the way we're maybe wired is that people don't want to leave here, even if here is like pretty much fully broken. They will white knuckle grab on to here. And so what you've got to do is you've got to get them. The temptation is to say, look how great there is, right? And kind of assuming that everyone knows how bad here is and so forth. The trick, actually, one of the little nuggets is that you've actually got to get them to let go of here. You've got to tell them and get them to agree of how bad here is. And once they start to loosen their grasp or let go a little bit, then they'll come slowly and steadily. There's some that'll come right away. They're uh, more change ready, and then others that are, the next wave and the next wave and so forth. There's kind of a bell curve there. A Rogers adoption curve is one way to
Mm.
look at that. And I kind of jokingly call, change management. It's never easy, by the way, even if you're experienced at it. But I call it's kind of like Red Rover. And what I think a lot of people, you remember that game when you were young? You ever play that game, Red Rover Come Over? Um,
I haven't, but for those that
oh,
maybe are in my boat that haven't played it
yeah.
before, would you mind maybe sharing a little bit about it?
Red, I don't know if the kids play it today. They're probably on their phones or something, but there would be
Yeah.
two lines. There would be two lines of kids, and you would say, Michael, Red Rover, Michael, come over. And then so you would leave your group, your line sideways,
Hmm.
and you would pick, holding hands, and you would pick whose hands you're going to break. You would just really simple, and you
Mm,
would just try to run through. And if you broke the hands, then you would get to pick one person and pull them back to your side. If you didn't break the hands, then you would have to join that team. So the Red Rover, whoever has the most people at the end, when you get down to one, you win and so forth. So
yeah.
um, leading change is kind of like Red Rover in that you're kind of starting out alone. A lot of people don't realize this is right. It's like I have an idea or I've noticed a big problem. Usually right, all the things, all the bullets on my resume have always been the biggest problems and that I just solved, right? So, but maybe you go to the owner, maybe you go to the president, but and it can't all be in one meeting because they're probably not thinking about that. It's like, hey, it's like
Yeah.
this, now you got to have this kind of leadership of, hey, Mr. CEO, I've been looking at this and I just want to talk to you sometime about it. Okay, that's it for now. And then maybe next week, yeah, I'm looking more into this. I've been running some graphs. It's really concerning when you get a minute. And now you're almost making them ask for it. It sounds silly, but they're busy running the business. So, as we all are. So, but once you get their ear, then you say, okay, you win them over, and then you win the next and next and next. And once you have kind of enough top level support, then you've got to do that with the whole workforce. So it's quite a chore, and I think that's why many folks are afraid of it. It's a lot of work for one, and
Yeah.
sometimes it goes well and sometimes it doesn't. But usually, if you're just honest and you let people get them involved, right? You tell them what's going on, why you're doing what you're doing, and don't talk for a year in management and then spring it on the employees. Leak it with them too, and say, we're looking at this, we're looking at this, we're looking at this. Nobody likes this one meeting where the world's turned upside down in 1 hour. And so all those messy, as I call them, kind of messy people things, we've got to do as well. But we help with that. Like, so at Self Fund Health and our health plan, we go in we're in the enrollment meetings and we coach the leaders and we help them through that process.
Yeah, it seems to me like that hand-holding process is the necessary component of whether a program gets launched as successful or not. And like you said, you're doing the shot across the bow. So much of this is like, in marketing, you're creating that level of anticipation and you're building the anticipation. Hey, we can't stay here anymore. Like, here's why it sucks. And then you get people to
Right.
kind of buy into that. It's like, all right, well, here's what there can look like. And that doesn't happen in one conversation. Totally agree with you. That's a
Right.
lot of mini milestones that happen over a stretch of time. And similarly, when you innovate, it's, you're not innovating in one day. I mean, sometimes depends if you're doing like a hackathon or something, but you know, otherwise it's incremental
Right.
um, over time. So how can folks sort of follow your work, continue to just sort of see what Self-Fund Health is doing, what you're doing? What's the best sort of way for folks to kind of tune into the things that you're working on?
Mhm. Yeah, so selffundhealth.com is our health plan, or Matt at Self Fund Health. And then the book is on Amazon, or I can send bulk as well and even sign them if we have advisors that like to hand them out. I'm actually probably within the next week or two, I'll actually finish a digital online course, which is kind of like video segments and a workbook of the book. So if you're different styles of learning, you can read it and then you can maybe watch the videos and then we're also starting a private community. And so that'll be maybe over a lunch hour and then but interaction because I found even when people read the book and then I'm talking to them, they're still not fully grasping some of these things. It just takes a while. I've been doing this 8+ years and it's just not something that can be picked up fast. We're trying to have a lot of support structure there to make sure that those who are motivated. And so I've had a lot of interest in since the books come out, of course, to speak and all over the country. And then also, how do I start what we had called a healthcare best practice group, which is almost up to 3,400 people today. How do we do that? And that's kind of the same things that you and I had talked about, how to lead change, how to get
Yeah.
others interested, how to encourage, and so there'll be kind of a community for that because no matter how well it's written or how well it's done in the online course, I think it still takes this kind of two-way interaction.
Undoubtedly. I think the best form of innovation happens in small groups, and sometimes those are the groups that you're not necessarily having to lead or be the one that's leading and guiding the discussion. Rather, you're letting sort of the cohort do things. So,
Hmm.
couldn't agree with you more there. I'd be remiss if I didn't mention this because I know that you're a proponent of caring for the community, not just in business and with everything that you're doing, but also some of the work you're doing around sort of the foster system. Would you mind maybe sort of
Hmm.
just sharing a little bit of that and kind of giving a plug for that as well?
Yeah, absolutely. So we've done that now for something like 7 years, and a lot of people don't know this, and I share, but I was actually bullied a lot as a kid, and I'm not almost my whole childhood. I'm not really sure why. And I played sports and everything, but so now I'm 6'5" and 250, and nobody picks on me anymore. But and I don't know why. But I was kind of just this scrawny, quiet kid. Maybe I was a good target, but I really had developed a passion for my root passion is helping people. And so, especially when someone is being kind of oppressed or abused, I just have this, like, I can't even hold, I'll just have this natural thing. I'll just step in respectfully and defend. And so I think the fostering is rooted in that. And my wife is passionate about it as well, of children, children, if adults are in a bad situation, at least we have the freedom to leave or move or something. And children are just in an absolutely vulnerable position. So in childhood attachment and those kinds of things are very relevant. If you've heard about the attachment research, it's one of the biggest predictors of
Yes.
adult health. And so the child, even the system sometimes isn't understanding those things. But if you can step in, we've taken 5 or 6 babies home from the hospital. We have 4 kids of our own, and then we have even grandchildren now. I'm old enough to be a grandchild. I tell my kids I was born in the 1900s, so I'm getting old. But we've had 20, 25 kids come through our home, and it's really weird to carry a baby home that's not yours. But yeah, we especially like the little babies. So yeah, that's something we've been doing for quite a while.
Well, I appreciate you even just sort of sharing that element. And for those that have tuned in to this conversation today, yeah, would you mind just sort of sharing it on your social media or even just indicating some of the areas that you felt were most compelling, whether it be a comment or a like? Every little bit of engagement goes a long way. So if we want to make things happen, it's about being in an authentic community where people can feel like they're in a safe space to make things work. So it's been great to have you on today, Matt, and I'm looking forward to future discussions and just jamming out on leadership and change management. So
Yeah,
thanks for coming
likewise,
on again.
Michael. Very, very much enjoyed it.